Augments in acetabular reconstruction plays vital role in filling the defects. Whenever we are doing total hip replacement, this is a shell which has to go and sit inside the acetabulum, this cavity. On this socket, this shell goes and sits. Some of the difficult scenarios where because of previous fractures, because of previous surgeries, because of some infections, and these defects are classified based on the based on the area where it is defective and based on the severity of the defects. Like if defect is only in one of the small areas, we can fix it with the regular hemispherical acetabular component, and then we can fix with some of the screws. However, if it is a very large defect, then in this kind of hemispherical component doesn't fit inside. When it doesn't fit inside, just with the screws it will not become stable so as to be able to person to walk on that. This acetabular component has to be very stable primarily, means when we fix it, it has to be stable primarily in order to weight bear on that. Means person will be walking on this, person will be walking on this like this, person will be walking on this. This cup, this shell, if it is not stable, person cannot put weight. When it is not stable, it becomes loose, it goes here and there. There may be dislocation, there may be loosening, there may be pain, not stability, not able to walk. Whenever there is defect in the acetabular, that is the defect in the, whenever I say acetabulum, that is a socket. Whenever there is a defect in the socket, we fill this defect with something like different shapes of the implants. Those different shaped implants are called as augments. Hello, myself Dr. Sharath, joint replacement and arthroscopy surgeon. Welcome to my channel. Here I am explaining the augments of the acetabulum and different shaped metals which are used to fill the defects of the socket. Here you can see there is a specific shape, this shape. This is called column buttress. If there is no column, this is called column. This socket has one of the area, this is called column. This is called column. This is a posterior, that is a back side. This is anterior, that is a front side column. If there is, usually the defect happens when there is a back of the acetabulum, that is the socket gets damaged due to fracture, due to infection, due to previous surgery, due to revision surgery, these situations. Whenever there is defective column, we put this kind of buttress augment. This is called column buttress augment. This comes right and left. You can see that it sits like this. Imagine there is no column. This is sitting and creating like a column. Here there is column. If there is no column, this sits like this, and we fix here with the screws and make it sit here. And once we create the column, this cup can be made to sit like this. So this cup and this will be fixed with the cement, and this cup will be fixed with the screws here, and this column buttress augment is fixed here. Sometimes this buttress augment doesn't sit on the bone. When it doesn't sit on the bone, we put something called shim augment. This comes in different diameters, different thickness and different angle. You can see is written as 15 degree, 10 degrees, 20 degrees. So this is the angle, this is the angle. So we can make it sit here and then fix this and fix this. Let's say this is not touching the bone, we put this shim augment, then put this column buttress, and then put this. Okay. So this is how we manage the column of the acetabulum. Then there is something else called as acetabular augment. This is half of the hemisphere. You can see this kind of shapes based on the diameter of this comes in different half diameters. You can see here we have different sizes. You see this is 62, 30, this is 62, 20, this is 54, This is 54, 15. So there are different sizes based on the diameter what we measure during the surgery. These different sizes are for the trials. We trial with these instruments and then we open the original augment. Where we are confident that this trial implant fits properly for this particular patient. You can see here that this acetabulum augment is fixed like this. Imagine that there is no superior, this weight bearing dome of the acetabulum, this is weight bearing area. If this is not there, if there is defective of this area, we fix here this and then we fix this cup. Let's say this cup. Let's say this cup. Means that the shell which is ideal for this particular patient after we fill this defect is going to be fixed here. We put this shell and then we put this shell so that this sphericity is maintained and the support for this acetabulum shell is given by this kind of augments. These are all the augments which are off the shelf augments, called off the shelf augments. Means we can get these augments different thickness and different sizes. It comes with the company, but they are not custom made augments. Now comes custom augments. We can do the 3D printing of this kind of bone of the defective acetabulum of the particular patient, and then this 3D printed model can be used to prepare the custom augments for particular shape. For example, defective area is in some specific area. That particular augment can be prepared by the custom augmentation by 3D printing, and then that particular augment is going to be fixed here, and then on that this shell is fixed, and then that completes the construct for the stability of the acetabulum. And there is this one. This is called medial wall buttress. There is something else called medial wall augment. This is a medial wall augment. This sits inside the medial wall of the acetabulum, and on this acetabular component is placed. Let's say defective area is here inside the medial wall, then we can fix it based on the defective area, which can be of different sizes, and then this sizes, and then over that we can fix this. So basically this is a medial wall, this is the acetabulum augment, this is the shim augment, this is the buttress augment. So these are the four kinds of augments we see when we do off the shelf augments, not a custom made augments. So off the shelf augments can be used whenever there is a defective of the acetabulum. If defect is very large, very massive defect, and multiple surgeries patient has undergone, then we have to do something to fill the acetabulum and then create the reconstructed socket. Then we can use custom augments. That requires 3D printing, and few days before planning of the surgery, then 3D printed model of the pelvis is sent to the company. They will see the defective area, they will prepare the custom augment that can be bought and that can be opened at the time of surgery, and then we can use the acetabular shell on that. That completes the construct, and that will help in reconstructing the acetabulum whenever there is large defect. Thank you for watching this video. I hope we have cleared the acetabular augments, and this will be really informative if you are searching for different augments and different kind of defect filling metals which are used in revision acetabular surgeries. Thank you.